Welcome back from the long weekend, everyone, and thank you for joining us today. I'm Teresa Marintet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Our tobacco and vaping enforcement officers were out over the weekend checking for compliance with provincial and local orders. Overall, of those businesses observed, compliance was very good. Education was provided on a few occasions related to proper mask use. It's important to remember that public health measures continue to be the most important protection to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer, use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when attending commercial establishments. I will now report our current case counts. There are 117,031 confirmed cases of COVID-19 in Canada and 39,449 cases in Ontario. Chatham-Kent has 248 cases and Sarnia-Lambton has reported 319 cases. Michigan now has 83,386 cases with 12,788 cases being in Detroit. Today, we are reporting 2,350 cases of COVID-19 in our community, an increase of 10 cases from yesterday. 5 are workers in the agri-farm sector, 1 is a healthcare worker, 3 people are in the community, and 1 case is still being investigated. 1,444 cases have now resolved, 797 people are self-isolating, and 14 people are in the hospital. 27% of our cases are between the ages of 20 and 29 years, and 24% are between the ages of 30 and 39 years, and 17% are between the ages of 40 and 49. 65% of our overall cases are male, and 35% are female. Less than 1% is unknown at this time. Our community has lost 71 people to COVID. 49 deaths have occurred among residents in long-term care and retirement homes. There are 2 long-term care and retirement homes in COVID outbreak. In addition, there are 12 workplace outbreaks. 5 are in the agriculture sector, and 6 are in the manufacturing sector, and 1 is a construction workplace. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak, or are experiencing severe chest pain if you're feeling confused or losing consciousness. Please be reminded that Windsor-Essex has 2 COVID assessment and testing centres, Erie Shores Healthcare in Leamington and Windsor Regional Hospital at campus. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. To check your results, please go to wechu.org and click on View Your Results to access the online test result portal. If you are unable to view your results, please contact the assessment center or healthcare provider that initiated your test. The health unit will call you if you have tested positive for COVID-19. Please continue to visit our website at wechu.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us again. Over the weekend, we had approximately 44 confirmed cases, including 16 farm workers, 21 cases from the community, 1 travel-related case, 1 healthcare worker, and 5 that were under investigation. Tobacco, vaping, and enforcement officers have been out in the community along with the bylaw officers, public health inspectors, and police, responding to compliance with local and provincial orders. In the beginning of this pandemic, we all become accustomed to seeing directional arrows, stand here signs, signage for wearing a mask, and washing your hands when out in the community. As I and my public health colleagues have continued to express, it is critical that we continue to follow public health measures to limit and control the spread of COVID-19 in our community. Everyone has an important role to play in this pandemic. Individuals must maintain physical distancing of at least 2 meters from others that are not part of your household or social circle. Do not gather in groups larger than 10 and maintain physical distancing. If physical distancing cannot be maintained, wear a non-medical face covering. Always wear a covering when in commercial establishment as per the local order. Wash your hands regularly with soap and water or sanitize with alcohol-based sanitizers. Clean and disinfect your home and high-touch surface regularly. Avoid touching your face and unwashed hands. Cover your cough and sneeze, and most importantly, stay home when you're sick, no matter how mild the symptoms are. Our workplaces and businesses that welcome the public also have a critical role to play through the development of clear health and safety policies that address physical distancing, cleaning, sick employees, and screening for COVID-19. Workplaces that are open to the public need to ensure that there are good visual cues within their establishment. These, combined with regular education, will ensure that the risk to employees and the public remain low. The Windsor-Essex County Health Unit has downloadable signs for workplaces that can be found on the workplace section of our COVID-19 homepage. Some of the available signs include stand here, visual cues for keeping 2 meters in lines or at registers, windows signage about the requirement to wear a face covering, windows signage alerting the public not to enter if sick, hand washing signage. It takes both the businesses and patrons to keep everyone safe and protected. Putting up signage, educating, and reinforcing policies, and following these basic public health measures are the only way to stop the spread of COVID-19 in our community. Thank you.
The conference is now unmuted.
We'll now take questions from the media. Any questions from Blackburn?
Hi. I guess just province announced today that we will be remaining in stage 2. I guess not a surprise, but what do you think it'll take for Windsor-Essex to advance?
Well, I think the data would be looked at later this week, and the numbers that we are seeing right now is definitely better than what we were seeing last week. We would continue to see less cases. That would be the most strongest indicator that we can look at before we move forward.
Thank you.
Any questions from AM 800?
Dr. Ahmed, just to that point, before Toronto moved to stage 3, their case numbers were in the ballpark range of 7 to 10, same with Peel. Our numbers are around that the past couple of days. So are you feeling optimistic that we're going to move to stage 3 hopefully soon?
I don't think that the numbers that you're quoting from Toronto and Peel are the same, but I'll take a look at it again. I don't remember that on top of my head, but generally speaking, the province is looking at the case rates, and the case rate is typically the provincial case rate right now is somewhere between 7 and 8 per 100,000 population. So based on that number, obviously we are still above the provincial average with the number of cases. What we are seeing is some case and activities outside of, are in a very specific sector, so which is the agricultural sector, and some of the cases that we are seeing still are restricted in Leamington and Kingsville area. So those will come into discussion and help us understand what the true risk to the community is, and so those conversations will happen, and we hope to see some favorable results soon.
Did you have to, I know you always say it's a provincial, at the end of the day it's a provincial decision, but did you and your team recommend for us to stay in stage 2 right now?
Well, I think the conversation doesn't go up to that far where they ask for our recommendations. They obviously look for our data, and they ask us to explain that data from a local perspective, that what's driving those numbers, and where those cases are, what type of cases are they, and what will be the impact of these cases in the community, and how we can mitigate the risk. In addition, obviously, we look at the health system capacity as well, public health system capacity, and based on the number of cases, our ability to respond to those cases. So all those come into play, and I guess at the end of the day, then they make that decision instead of asking us to make a recommendation.
Thank you.
Any questions from Winterstar?
Yes, good morning, Doctor. You said the data may be looked at later this week. Do you have any sense of when we may hear an update to today's decision?
I would anticipate that we may hear on Friday, but again, those are something that we don't know for sure. That's typically the discussions that we happen and at an appropriate timeline. I expect to have that discussion either on Wednesday or Thursday, and we'll see where we go from there.
And today you talked a lot about signage at businesses and how businesses can do their part to help the general public comply with public health measures. Are you seeing any lack in the business community there, or is this just a reminder?
Well, it's a bit of both. I think there are some businesses where maybe these signs and these pathways, the stand here, or a directional follow is not there anymore. Either they're, I guess, over the time those signage disappeared for any reason. But I think it is still important that it is there. It serves as a good reminder to the general public that how they will be moving across the different aisles of a grocery stores or a store where they're going, where they're coming in contact with many people. Those signages, those directional arrows, it definitely helps the flow of the people and overall helps to keep maintain the physical distancing that we talk about.
Thank you.
Any questions from CTV?
Good morning. Is it fair to wonder if Chatham-Kent's lack of a mask mandate is contributing to the agriculture sector being this hot zone for so long in the Leamington-Kingsville area, given the border?
I can't speak specifically to that part because I don't know what's happening in Chatham-Kent in that level of detail that the local public health officials from Chatham-Kent can comment. What I can say from our perspective is obviously we did got some federal support to with respect to the mask on these agricultural farm sectors, which is so the federal government did came out with their donation of PPE and masks for our agriculture farm sector. So we're in the process of distributing it and the other partners who are engaged in working with these sectors. So we are providing that and hoping that with our continued support, we will be able to push that industry and bring them and provide them with all the right tools that they need to fight COVID-19.
You said one of the only ways in fighting this is masks, and Chatham-Kent's medical officer of health doesn't support wearing masks. So I'm curious, when is the last time you have spoken with Chatham-Kent's top health official?
Let me just go back to some of the basic public health measures. The basic public health measure still is the physical distancing is the most important measure, and it's an additive effect. And combined with the physical distancing, the mask and some of the other recommendations adds up to the safety of the individual. So all these things are additive, and not one thing would be only thing that will take us will move us forward. So I think those are all the consideration, and I'm sure that all the public health officials are looking at those recommendations and making a recommendation based on their local needs.
Thank you.
Any questions from CBC?
Hi, Dr. Ahmed. I'm just wondering, have there been any fines issued for businesses not complying with provincial or public health orders? And if so, how many?
No fines have been issued so far. It's just by us, specifically from public health. And if we get to that stage, we'll report it back.
Thank you.
Any questions from Radio Canada?
Yes, thank you. So I'd just like to know how many people are in the emergency medical assistant team that came to help for the situation.
I'm looking at my team member. I don't have an exact number. Maybe we can get back to you on that one. But obviously, the team is very focused on providing some of the support at the hotel. And and my team member is just suggesting that it's probably 6, but we can confirm if you're looking for a hard number.
Yes, because when they just arrived in Windsor-Essex, I spoke with the mayor of Kingsville, and he told me that he thought that there were 2 people.
No, I think at different times, and obviously it all depends on the need, and sometimes some of these planning pieces, it takes time of who's coming and then what kind of additional support that they need, and over the time, the processes, the need evolves and it changes. It can either bring more people, it can either maybe just send some people back. So I think it all depends on the plan. Right now, they're heavily engaged in providing that support to the isolation hotels that are in our community, and I'm sure that they will continue to provide that level of support that they're doing right now.
Okay. Also, I've been told that some students work in agricultural companies and are undeclared. Did you know about that? And does it could play a role in the community transmission?
Can you repeat your question? So students who work in the agri-farm sector?
So, yeah, I've been told that some students work in some agricultural companies and are undeclared. They are paid, they are not declared, so they are paid cash.
Okay.
Is it possible that did you know about that? And is it possible that it plays a role in the community transmission?
Most of these companies that are employing any of these workers, they are under the Section 22 order, a class order that prevents them from contracting many of these workers. And in instances where some of these workers are working, especially in the I'm forgetting the name, but the corn detasseling, the corn detasseling process, those work can be carried out, especially if these are all outdoor work with appropriate physical distancing, and they are not coming in contact with the rest of the workers. So those are the only way that they can work. But anyone else, if they're employing students or anyone to work in the farm alongside with other, it will be in a violation of a Section 22 order that's already given out to them.
Okay. And do asymptomatic people are still authorized to work in the sector?
So at this point, anyone who's tested positive, none of them are working, and anyone who is identified as a close contact, they are all self-isolating.
Okay. And how many farms have been tested so far?
We are focused on from a public health side perspective, not on just completing the testing of the farms. We are trying to do our case and contact management with the farms that are currently we have, and also there's a separate strategy that is working to enlist farms to get them tested. So there's two parallel process that's been going on right now.
Okay, so I could write how many?
I would say that maybe connect with Ontario Health, because they are the one who is doing this broader strategy on the testing piece of all the farms. We are focused on the case and contact management side of the things.
Okay, thank you very much.
Any further questions from Blackburn?
No, thank you.
Any further questions from AM 800?
Teresa, for the healthcare worker today, is that a local healthcare worker or one that works in?
So Teresa is just stepped out. Rob, it's still me, and it's a local worker.
And then Dr. Ahmed, when you say travel related, I know there was one over the weekend. Is that someone from Windsor-Essex who went outside of Windsor-Essex in Canada? They went to Canada, someplace in Canada or the province?
So this is a travel related outside of North America.
Okay, thank you.
Any further questions from Windsor-Star?
No, thank you.
CTV?
I'm curious if the health unit has any opinion on extracurricular activities in schools, if the province will be wanting more of those, or is there any suggestions to having more extracurriculars?
So I think at this time around in the pandemic, we are also trying to restrict the unnecessary activities as minimum as possible, recognizing that getting back to school is an important and critical step in the educating our children and young minds. So there has to be that balance. We'll have to see where the community is with respect to what kind of extracurricular activities that are being performed. If it pertains to physical activity, keeping active, and if it can be done in a safer manner, then obviously, yes, public health will be supportive of that. But I think those are some of the things that we'll still have to look and to see where the community is and what kind of activity that we are talking about, and we can work accordingly. But the bottom line continues to be the same: the safety and well-being of everyone, including our children.
How can Windsor-Essex effectively plan returning to school? We're going to be hearing about it tonight when we aren't in stage 3 yet. We're still in stage 2. The rest of the province is in stage 3. I don't know. It seems like we're behind. What's your take on that then, on the two topics there?
Well, I think it's all about the risk to the community when we're talking about it. And obviously, with all the plans that are being proposed right now, there has to be that component of safety and a review of the plan to ensure the safety and well-being of the children returning to school. And just opening up school doesn't necessarily equate directly to the risk if it can be done safely. So I think the key question that comes to my mind is, what is the plan in place and how we're protecting our children and how the schools can implement all those policies. So those would be our focus. And right now, I'm confident with the numbers that we are seeing right now that, just like the rest of the province, we may move into stage 3, then it'll be a more question of what more we need to do as a community to keep ourselves safe and keep our numbers down. And just continue to work on it. We all need to work together, each and every one of us, and we'll get there.
Can I ask one more?
Okay.
I'm just curious if the health unit would recommend Windsor-Essex remaining in stage 2 should another jurisdiction in Ontario or in Southern Ontario regress or go back into stage 2?
So I think overall the pandemic, we obviously are more focused on our data. So my responsibility is to my community and the risk to our community. I'll be looking at the numbers, the data, the risk to my community, as opposed to making a decision based on how the other jurisdiction is doing. Hopefully that we're all in this together, not our community, but the rest of the community as well. We just need to make sure that we have appropriate processes and safety measures in place to prevent any of these cases from spilling from one region to another, and to make us put us in a position where we are concerned about the number of cases right now. With the number of cases that we have in our region, I think that's on its own, it's a significant enough number that keep all of us awake and keep us working. I wouldn't be worried about what's happening in the other region unless unless I have more concerns about my own community.
Thank you.
Any further questions from CBC?
I'm good, thank you.
Radio Canada?
I'm fine, thank you very much.
Okay. Thank you, everyone.